Okay, can everybody hear me? Excellent. We're going to go ahead and get started to accommodate those who are joining us at home via our live webinar. We will have some people coming in during the process, but that's okay. We'll just go ahead and get started. My name is Danny Hartley. I work here at Children's Hospital and Medical Center, and I want to thank you all for coming to our Parenting U session tonight on preparing for a newborn. A couple housekeeping rules. Enjoy your meal. We do have trash located outside of the doors for when you guys leave. You can just throw your trash away. We have restroom facilities out the door and to your left. Child care services are out the door and to your right. I want to thank you all for coming tonight to learn about how to prepare for the newborn that are all joining your households in the near future. Our speaker tonight is John Andreessen. He is a pediatrician with our Children's Physician's Office at Val Verde, which is located in La Vista at 98th and Giles. He's been with the organization for about 6 years now, and you guys are in good hands because he's going to offer you some great clinical information, practical tips and advice, and just kind of let you know what to expect with your new arrival that's coming. So without further ado, I give you John Andreessen.
Thank you. First of all, congratulations to all of you for being here tonight. That means you're probably expecting a baby, or else you're in the wrong room. So if you're in the wrong room, let us know what you're here for, and we'll direct you to the right seminar. But anybody due within the next week? Okay, I'm going to make this really quick then, because I know a lot about babies, but not much about delivering them. So please hold on for the next hour. As Danny mentioned, I have been with Children's Physicians now for 6 years. I've been a pediatrician for 6 years, and those of you that are doing the math in your head are thinking either, man, he's really let himself go, or something else is going on. And just to kind of give you just a brief synopsis of myself, I was actually a Lutheran minister prior to working for the American Cancer Society for a while, prior to going to medical school. And was actually interested in being a family practitioner until I took my pediatrics rotation and had a blast. And so that's how I wound up where I am today. How many of you have other children? Okay. Well, we'll kind of talk a little bit about some issues that will come up with that too tonight. But I'm going to go ahead and get started. You all have the handout with you. And you can follow along with that if you want to take notes. I've left time at the end for questions, but if anybody has any questions as we go along and you want to feel free to make this a dialogue, that's great with me. So again, congratulations. Some of you are into this for the first time. And there's a part of me that says, well, this is kind of a silly talk to give because there really is no preparation for having a baby. It's just something that happens and then you're kind of on your own. Because as I mentioned at the end of the talk, everything that we're talking about tonight, your baby doesn't have a clue about. They haven't read the books, they haven't been to the seminars, so they're going to come up with all kinds of ways to surprise you and throw curveballs at you, but that's okay. And so we're going to look at some things tonight that you can do to help prepare for this big event. First of all, before the baby even arrives, and some of this may seem like common sense, but at the same time, it's amazing how many people, once they get to the hospital, are wishing that they had brought things or remembered things and so forth. So before the baby arrives, make sure your bags are packed, because even though your due date may be May 27th, the baby doesn't know that. And the baby's going to come when the baby's ready. So you may need to have your stuff packed and ready to go. And I just included there a list of some things to bring. You know, obviously you need to bring clothes for yourself. And dads, if you're planning on staying, you need to bring some clothes for yourself too. Definitely you want to bring some toiletries. Bring a camera. And they certainly encourage you, and you're going to want to take pictures of this really fun event. And I'd hate for you to get there and then realize that you left the camera at home. Most of you are probably more technologically proficient than I am, and so you have cell phones, and you probably won't have to worry about that. But anyway, make sure you bring something to record this event. Bring some clothes and outfits for the baby. They will provide you with onesies, which if you're not familiar with those are those kind of long sleeve, no pants, things that snap down in the crotch area. They will provide those for you, but they don't have any of the fancy outfits. And I'm sure all of you will want your babies in those, especially if you're planning on getting photos taken. Most of the hospitals here in town do have a baby picture thing. And if you haven't been to your hospital already and talked with the folks there, when you do go and look, mention that to them. And if you don't get a chance to do that, this is just to let you know that they do have baby pictures, but you need to provide the outfits for those. They also will provide you with diapers and wipes, so you don't have to bring those with you. So, but everything else that you'll need, hair bands, little cute hats. They do provide kind of a stocking cap for you, but if you want to bring a cute little cap, you need to bring those from home. Some other things to think about is the baby's room ready. And this is one thing that I always like to tell parents. Babies don't see color till at least 6 months of age. So if grandma and grandpa want to paint want to paint whatever color they want, and that's what they want to do for you, that's fine. It doesn't really matter. Pink and blue, they can't tell the difference. Everything's going to be gray to them. So, don't worry about that for a while if you haven't gotten the room painted yet. Make sure you've taken all your classes. Most hospitals do offer prenatal classes. If you plan on doing Lamaze, make sure you've gotten signed up for that. Any other classes that you want to do. And then also, have you selected a doctor for the baby? Preferably a pediatrician, but some of you who do see family practice docs, and maybe the family practice doctor is delivering the baby and is going to be the baby's doctor, make sure you have visited with them. And if you are selecting a pediatrician and you don't have any other children, most pediatricians in town will allow you to do a kind of a get-to-know-you visit, where you can come in, meet the pediatrician, they can meet you, you can ask them any kinds of questions you have. You can go over things like office hours and all sorts of questions that you may have about that. And we actually invite and enjoy meeting with all of you. Finally, make sure you have a car seat, because you'll need one of those. They will not let you go home if you don't have a car seat. So I'll just tell you that right now. So if you're looking for something to ask for a baby shower gift, that's a great idea. But it is something that's required. So now kind of into the nuts and bolts of what actually happens when the baby arrives. Obviously, there's two ways of delivery, cesarean section and vaginal delivery, and those will kind of depend on the baby and kind of depend on what exactly is going on. If the labor slows down, if the baby is in what we call the breech position, which is feet first, and the obstetrician can't get the baby turned around, or if there's some sort of emergency, obviously a cesarean section will be what happens. But the baby's born, and the first thing what will happen is one of the nurses, or sometimes it's a job that gets delegated to the medical student, will suction and stimulate and dry off the baby. Suctioning is usually done with just one of those bulb syringes. Depending upon how the delivery is going, sometimes they will suction a little more deeply. You may hear the OB say something about we're going to have to suction at the perineum. They may actually take the baby to what we call the resuscitation room, where they do suctioning also. And the reason we do that is we don't want babies to aspirate. And obviously, when you stimulate anybody, the first thing that they tend to do is take a deep breath in. So we want to make sure their mouth, their nose, everything is cleared out of any secretions before the baby starts to breathe. Again, the babies don't know that. And so sometimes babies are born, and as soon as they pop out, the first thing they do is they scream and they cry before we even have had a chance to suction them. And the vast majority of times that does not cause any problems. But just to keep in mind, that's what's going to happen. They're going to suction the baby, then they're going to try and stimulate the baby. And a lot of times the way they stimulate the baby is just by drying the baby off, by rubbing their feet, maybe by rubbing their chest or their back. We do not hold the baby upside down and spank them. So for those of you that wanted to get a picture of that, sorry, you'll have to kind of stage that in the privacy of your own room, but we don't stimulate babies that way. We will assign what's called an APGAR score. And you may hear people talking about that. You may hear one of the nurses say, what are the APGARs? And these are basically, it's a 5-point scale system. And it's kind of fun the way this works out because it stands for appearance, pulse, grimace, activity, and respirations. And those of you are probably thinking, well, that's kind of neat the way they made that mnemonic and then they named them the APGAR scores. But it was actually a Dr. APGAR, and I believe her name was Virginia, and she was a pediatrician in Maryland back in the 1940s, 1950s, and she actually came up with the scoring system, which they named after her, and then generations of medical students, in order to remember what it stands for, applied the mnemonic to her name. But we give these scores at 1 and 5 minutes. So when the baby's born, a lot of times one of the nurses will hit a little timer and you'll hear a beeping noise after about a minute and they'll say something like, oh, it looks like an 8. And then they'll go on, and then at 4 minutes later you'll hear possibly another beep and somebody will say, oh, it's a 9. The APGAR scores go from 0 to 10. I had probably the dean of neonatologists here in Omaha when I worked with him as a resident, who said that even baby Jesus didn't get a 10. So don't feel bad if you get a 9 and a 9 or an 8 and a 9 or a 7 and a 9. These scores really don't mean anything later in life, but they're a way for us to determine how well your baby is doing transitioning from being in the womb to being outside of the womb. And so we will give those scores. It's always fun, if you want to. A lot of baby books will have a little thing when the baby's born. They have a little section for APGARs, and it'll say 1 and 5. And you can ask the nurse if you want to what the baby's APGAR scores were. It's kind of fun to have that, but basically it's a way for us to look at how the baby's doing after they've been born. They will apply an antibiotic eye ointment to the baby's eyes, and they will give the baby a shot of vitamin K. If you want to gross out a bunch of junior high students, you can tell them that vitamin K comes from the bacteria that live in our gut. That's how we make vitamin K, and babies are born without bacteria in their gut, so therefore they can't make vitamin K for a few days. Vitamin K is very, very, very important in the blood clotting process. So that's why it's important that we give babies a shot of vitamin K. After that's been done and after the baby's been examined by the nurses, the baby will be swaddled and be given back to you guys. And that usually, the whole process of doing what we're doing doesn't take very long. So you'll get to hold your baby pretty quickly. A lot of times now, increasingly, what we're doing is when the baby is actually born, they will put the baby on the mom's abdomen, let some bonding occur, but then quickly do whatever we need to do and then get the baby back to you guys. The nursing staff will call the pediatrician's office. So your job will be to let the office or the nurses know who your pediatrician is, and then they take care of everything. And most of us, we are required by law actually to see the baby within the first 24 hours of life. So if the baby is born in the morning, 8, 9 o'clock, anytime up till about 4 o'clock in the afternoon, the nurses will call us in the office, and a lot of times we will try and see the baby before, after office hours while we're going home. For those of you that have had babies before or have worked with this, you know that there are no babies that are born between 8 o'clock in the morning and 4 o'clock in the afternoon. They're all born at 3 o'clock in the morning. And so what happens then is that the nurses will call the answering service. The answering service will call us usually about 6 or 6:30 in the morning, and then we'll stop and see the babies in the morning. And basically what we do is we do a complete and thorough physical exam on the baby. We make sure that they have all their parts. We make sure that all their parts are working. And then we usually will come in and visit with you each morning that you're in the hospital, kind of give you an update on how things are going. And it gives you an opportunity to ask questions about, how come they did this? What's the meaning of, they spit up or whatever. Because babies come up, as we'll talk about in a little bit, babies come up with all kinds of things to do to drive their parents crazy. And it only gets worse as they become teenagers. So the other thing that will happen is your baby will get a bath. And that will usually be done within the first couple of hours. The nursing staff does that usually back in the nursery. And then that'll be taken care of. Your responsibilities will be especially to keep track of how often the baby eats. If you're using formula, how much they take. If you're nursing, how long they nurse. And are they pooping and are they peeing? And we want to see a baby do both of those things within the first 24 hours of life. If they don't, that's usually not a concern. It usually just means they need to eat a little more or drink a little more. But that is something we like to see babies do. The other important thing you need to do is just enjoy your baby. Get to know your baby. But don't be embarrassed or ashamed or frustrated if you want to send the baby to the nursery. The nurseries are there for a reason. They're staffed by very good nurses, and you guys are going to need your sleep too. So that's very important. Moms especially, you're going to need to get some rest. Childbirth, for those of you that have already been through it, is a very emotional time. There is a wide gamut of emotions that occur during the birthing process. My OB rotation as a medical student was probably the most, I guess the word would be exhilarating, because you would see these, and please, ladies, don't be offended, but you would see these moms go from this absolute rage to just a hysterical ball of tears within a course of 5 or 6 minutes. And so it's a very emotional time, and you're going to need your rest and you're going to need your nutrition. So please don't worry about having your baby go to the nursery for a few hours so that you can just relax and rest, because you have to take care of yourself too. So the next big question is, what do we feed the baby? And you have two choices, breast milk or formula. The American Academy of Pediatrics recommends breast milk for the first year of life. There are pros and cons to both nursing and to formula. And whichever you choose, and I'm here to say that as a representative of the American Academy of Pediatrics, we do recommend breast milk for the first year of life. But I'm also here to say that ultimately that is your decision. And there has been a lot of research done on formula versus breastfeeding. And I feel that both of them are equally beneficial. The important thing is that you feed your baby. That's the most important thing. And for the first 2 weeks or so of life, or until, and we'll touch on this again, until your baby gets back to birth weight, it's important to feed your baby every 2 to 3 hours. And whether they want to nurse or whether you want to bottle feed, but it's important to pretty much feed them on a schedule. That kind of gets them into the habit of eating. Because this sounds really stupid, but they've never eaten before. They've gotten all their nutrition for the first 9 months through the placenta and through the umbilical cord. So babies are born with a natural suck instinct. When your baby's born, put your finger in their mouth, you'll know what I'm talking about. So the baby is able to instinctively suck right away, but if they suck on something and nothing happens, they get mad. But they kind of learn right away to suck. And so starting to feed them right away is a good thing to do. Your baby will let you know if they're hungry before 2 or 3 hours. They'll get very restless and they'll do what's called rooting. Rooting is where they are looking for something to suck on. And if you're not available or the bottle's not available, the fist will do. The thumb will do. My favorite story of rooting is a very good friend of mine who, this was back when I was a Lutheran minister, and it was his first child, and it was June, and he lived in a house with his wife that just kind of had a window air conditioner, and it was hot, so he had his shirt off and he was holding his daughter, and somebody came to the door. I think it was probably like a Jehovah's Witness, and so he was standing there, and his 3-week-old daughter didn't know the difference, saw the nipple, and latched on. He said he almost dropped her because that's what babies do. They will root and they will attach. So as you learn those signs that your baby gives, you learn to respond to that, and that actually bonding process helps build trust in your baby that they know that when they root, they'll get something to eat. So even at the very early couple weeks old, they're learning those lessons. Briefly about breast milk, it's natural, obviously, and it's a lot cheaper. For the first few days, you will produce something called colostrum. And colostrum is kind of like a baby Atkins diet. It's very, very high in protein, very limited in carbohydrates, and very limited in fat. Because of that, picture yourself, if you're hungry, how you would react if you went to Anthony's Steakhouse and ordered the best steak on the menu, but just ate that. No potatoes, no rolls, nothing else. 2 hours later, you're probably going to be hungry again. And that's what happens with colostrum. You may notice that your baby wants to feed more frequently because they just feel hungry. I have absolutely no experience on this, not being a woman, but most women will tell you they can tell when their breast milk lets down. And when that happens, you'll notice that your baby is a lot more satisfied, is more content, and may start to stretch out that feeding on demand from every hour and a half to maybe every 2 to 3 hours. So you'll start to get a little bit more rest. An important thing about breast milk is it provides essential amino acids, and it also provides antibodies that help babies fight infection. And as I mentioned, many women enjoy the bonding process that occurs with nursing. You can pump. You can, especially if you're planning on going back to work, you may, once your milk comes in, you may want to start to pump in the thought of, number one, building up a supply of breast milk. Number two, and this is kind of one of the advantages of formula, dad can help if you're pumping. So that's something else to keep in mind. One of the important things with formula, and one of probably the biggest advantage it has over breast milk, is you can tell how much your baby eats. So if you feed the baby 30 cc's, which is an ounce, 30 cc's of formula, you know they've gotten an ounce of formula. When a baby is nursing, you really don't know how much they're getting. You can kind of guesstimate if you do supplement with breastfeeding, give the baby an ounce, time them how long it takes to eat that much, and then let them nurse. So if it takes them 10 minutes to take an ounce, probably it takes them about 10 minutes to get an ounce when they're nursing. So something to keep in mind. But a lot of times we recommend that newborns, if they're eating every 3 hours and they're taking 2 ounces, they should be getting 16 to 20 ounces a day. It's very easy to determine that if you're formula feeding. Breastfeeding, it's not as easy to determine. A lot of formulas have added amino acids and probiotics. Probiotics are the things that build our immune system. And dad can help with the formula too. But no matter which one you do, it's important that you feed your baby. That's the most important message to take from this. A few things will happen in the hospital while you're there. Number one, we screen all newborns in Nebraska for hearing. They will take the baby down to the nursery, and what they do is they have these little electrodes that look like what we use for EKGs, which are the things we stick on your chest to monitor your heart rate. We put them behind the baby's ear, and then we fire a series of clicks. And if the baby can hear, the electrode will monitor that and will fire a little signal, and then we'll know the baby can hear. I tell all my newborn parents that this is no guarantee for listening. It only checks to see that they can hear. The other one, you're kind of on your own for that. And it gets worse as they get older. And guys, I hate to say it, but I think it's carried on the Y chromosome because every woman I've ever known says it's a lot more prominent in men than it is in women. So the other thing that they will do is a state metabolic screen. Currently, Nebraska has a required screening for, I believe it's 8 diseases. Hypothyroidism, something called PKU. We screen for cystic fibrosis. We screen for sickle cell and a couple of other diseases. What they will do is after the baby is 24 hours old, they will poke the baby's heel and they will take 2 or 3 drops of blood and put it on a piece of filter paper. And that's actually all they need. It's pretty amazing what they can do with that small amount of blood. There's also a state supplemental screen which screens for an additional 34 metabolic diseases, most of which I can't even pronounce, but most of which are very rare and most of which can be controlled by diet. So if we find a baby who has one of those early, we can adjust their diet and usually prevent some pretty devastating consequences. Again, those are done. That screening is supplemental. We recommend it. I recommend it for all parents because it's just kind of nice to know that all of that is negative. We usually have the results back in 2 weeks. There are only 2 labs in the country that do this metabolic screening. One is at Penn State and one is at Baylor. So you can imagine they get a lot of work, and it's amazing they can get it turned around in 2 weeks. But usually when you go back for your 2-week visit, they have the results. If those of you that are having a boy, one of the questions that will be asked is, do you want to circumcise the baby? And we'll touch on that again. Your baby will lose weight, and that's nothing to be alarmed about. Most of that is water weight, and they will gain that back by the first 2 weeks of life. But that is something that will happen, and we like to warn parents of that ahead of time so that they don't get concerned. And then we'll also monitor the baby for jaundice, and we'll talk about that in a bit here. Circumcision is the surgical removal of the foreskin from the penis, for those of you that aren't sure what that is. It is a religious custom in several faiths, and there is some evidence that it does have a health benefit. And this is always one that's difficult to talk to parents about because the health benefit that it does provide is that it cuts down on the amount of sexually transmitted diseases in men. And it's kind of hard to talk to parents about a newborn baby, but that is something 25 years down the road that may or may not be an issue. But that is evidence that it does prevent some of those. Obstetricians and pediatricians can both do the circumcision, and they will provide you with education when you're discharged on how to care for that. There will be a surgical, what we call Surgiseal, which is like a gauze that's wrapped in antibiotic and Vaseline that's wrapped around the head of the penis after the circumcision is done. That stays on for a couple days, and then after it falls off, we just recommend that you apply Vaseline either to the penis or to the diaper where it's going to hit the penis for the next 2 weeks, just to keep that from scabbing over and causing any problems. Jaundice is when the baby turns yellow or orange. It's caused by increased levels of bilirubin. Bilirubin is a byproduct of our red blood cells, and we recycle it. All of us right now, as we're sitting here and as I'm standing here, are recycling our bilirubin. The reason babies turn yellow is 2 things. Number 1, they turn their red blood cells over a lot faster than we do, and number 2, their liver is immature, and the liver is the organ that kind of takes care of all this. So consequently, because they're making more bilirubin and they're not able to handle it as well, it gets deposited in the skin, and that's why they turn orange or yellow. The reason we're concerned about it is if the bilirubin level gets above a certain number, and that number gets bigger as the baby gets older, but if it gets above a certain level, the body will deposit excess bilirubin in a part of the brain called the basal ganglia. And the basal ganglia, just briefly, is part of the area of the brain that controls movement. So if your brain, which is the front part, says, okay, I'm going to pick up my sandwich and eat it, that message has got to go through the basal ganglia to the arm. And if there's problems with the basal ganglia, you don't have really good control over trying to do that. That is called kernicterus, and in the old days, it was one of the leading causes of cerebral palsy and spasticity. Fortunately, that's why we watch it so diligently now, is because if a baby's bilirubin level is going up and getting dangerous, we put them under what's called phototherapy. For those of you that have never seen phototherapy, it looks like a big glow light. And we either wrap the baby in one of those, or sometimes we put them in a box and we put these little goggles on them, and then we treat them with that. It's a very safe treatment mechanism, and usually only needs to be done for a couple days. There's two other kinds of jaundice. One is called breastfeeding jaundice. It usually happens when it takes a while for mom's milk to come in, because the other way we get rid of excess bilirubin besides depositing it in our skin is pooping it out. And if you're not eating enough, you're not pooping enough, and therefore the jaundice builds up in your body. Interestingly enough, there is also an enzyme in milk that delays the maturation of the liver. So there's also something called breast milk jaundice. Again, that doesn't mean we want you to stop breastfeeding or stop nursing if that's what you choose to do. But if we think that's the cause of your baby's jaundice, we may have you hold off on breastfeeding for a couple days, continue to pump, feed the baby formula. We'll put the baby on phototherapy, and once everything's back to normal, you can go ahead and bottle feed the baby breast milk. You'll hear terms tossed around: conjugated and unconjugated bilirubin. The unconjugated one is usually the one that's really high in most babies. It just means that the liver hasn't worked. Conjugated bilirubin, if it's elevated, is a cause for concern. It means the liver is working, it's conjugating the bilirubin, but for some reason it's not getting out of the liver, and so it's getting spilled into the bloodstream. The biggest cause for that is babies that are born without a biliary system. We call that biliary atresia, meaning there's no way for the stuff that the liver makes to get into the gut. And if that does happen, that's very, very, very rare. So I don't want you to panic about that. But if that does happen, usually we're consulting with the pediatric surgeons, and there's a couple of different surgical procedures that they can do to take care of that. So a really fun topic is pooping and peeing, especially at dinner time. Babies are really good at doing this. The initial stools are called meconium. Those of you that have had previous children will know that NASA really could use meconium to attach the tiles to the space shuttle, because this stuff is impossible to get off. I have two stepchildren. I came into their lives when they were 4 and 11. There are a couple of old nurses still at the University of Nebraska Medical Center who, if you ask them about Dr. Andreessen's first attempt to change a diaper, they will laugh at you and tell you a great story, because the rule in the nursery is if you find it, you change it. And as a third-year medical student, I found one and tried to change it. And of course, I scrubbed and scrubbed and scrubbed, and then didn't have a spare diaper there. And so the first thing that happens, and guys and gals, if you've never changed a diaper before, when the diaper wipe, which is cold, hits the warm skin of the baby, because you're cleaning off the poop, it automatically triggers another reaction. And if you're standing in the line of fire, especially guys, you might want to step to the side when you do that, because as happened to me, you will get wet. So anyway, meconium is the initial black tarry stools that babies have. And it really is tough to clean off. You have to kind of work at it. But eventually it will get clean. The other good news is after 2 or 3 days, and especially as mom's milk comes in, it will change over to normal, what we call breastfed stools, or normal formula stools, which are soft and yellow and seedy. Usually babies will make 4 to 10 wet diapers a day, and if you see some orangish or rust-colored crystals in the urine, that's completely normal. It's not blood, it's actually urate crystals, and it's nothing to be concerned about. If you are breastfeeding your baby, know that they can poop 10 times in one day, or they can poop one time in 10 days, or anywhere in between. Breastfed babies, it's all over the place. Usually formula-fed babies will poop 3 or 4 times a day. Usually, again, the baby doesn't know that, so they may fool you with that, but that's usually what happens. The question we always get is, my baby's constipated. Well, how do you know? Well, because when they poop, they pull their legs up, they turn red, they get really mad, and they cry and they scream, and their belly gets really hard. And the question I always ask the parents is, what happens when they poop? And if it's soft and it's yellow and it's seedy, they're not constipated. If they're hard pellets, then they are constipated. The vast majority of times, though, it's the soft, yellow, seedy poop. And what happens, and again, this is an ongoing theme, but the baby hasn't read the book, but for those of you that have taken any anatomy or physiology, we have 2 rings of muscle that keep the poop inside of us, the internal and the external anal sphincter. And the internal anal sphincter we have no control over, and when there's poop down there, it relaxes. The external anal sphincter is a different story. That's the one that you can squeeze. And invariably when babies have to poop and they start to push, they squeeze their butt shut. And so they're squeezing against a closed sphincter, and they get mad and they yell and they pull their legs up. And the external anal sphincter is a skeletal muscle. So if you take a 2-pound weight and you hold it like this, it's a piece of cake for about a minute, and then eventually your arm starts to shake, and eventually that muscle relaxes, which is the same thing that happens when the baby's got their butt squeezed shut. Eventually that muscle relaxes, and then the poop comes flooding out, and it's nice and soft and yellow, and your baby's not constipated. They just have to learn, which happens around 18 months to 2 years of age, that there's a muscle there that they can control and that they can relax. And so that's not constipation. Briefly, to go over the first 2 weeks of life, initially they'll lose weight, but they'll regain that by their 2-week visit. And once they've gained their birth weight back, you can start to feed them on demand. You don't have to do the scheduled every 2 to 3 hours. Remember that the baby came from a womb that was very dark, and so that's normal. So when it's pitch black at 3 o'clock in the morning, the baby's like, aha, this is what I'm used to. That's when they'll be awake. That's when they'll want to play. That's when they'll want to talk to you and coo and cry and do all the really cute things that you're trying to get some sleep on. So I always tell parents that very early on you need to start training the baby that daytime is when you're awake, nighttime is when you sleep. And you do that by, during the day when they're awake, give them lots of stimulation, lots of interaction. Talk to them, sing to them, anything that you want to do. Walk with them, rock them, all those type of things. Remembering that a baby can only see very well about 12 to 15 inches away. So you have to hold them close for them to focus in on you. At nighttime, obviously they're going to wake up, they're going to be wet, they're going to be dirty, they're going to be hungry. You do what you need to do, and you're done. Have a very soft, subtle light on in the corner. Go in, change the baby, feed the baby, put the baby back to bed. And I know it's hard because they're cute and they're cuddly, and maybe if dad has gone back to work, that might be a good time for dad to interact with the baby, but you're going to break that day-night cycle a lot quicker if you kind of stick to that routine, because babies are very focused on routine. If they learn that nighttime is pretty straightforward, then they'll start to stay awake more during the day and interact with you more. We like to see the baby usually at 2 weeks of age. The big thing is going to be to make sure that they've gained their birth weight back. But again, we usually will see them right after they're discharged too, just to kind of check for jaundice and to make sure everything's going okay. However, there are some concerns, and these are reasons why we would need to see a baby sooner. The first one is a fever, and a fever is 100.5 or higher. And I will just tell you this so that, and I always struggle with telling parents this because I don't want them to think, oh, well, it's only 100.5, I'm not going to call the doctor. The first 4 weeks of life, if your baby has a fever, they will be admitted to the hospital. The reason why is because we're very concerned about something called sepsis. Sepsis is blood infection, and we don't know if a baby is septic or if a baby has a fever because little Billy came home from daycare with a cold, didn't wash his hands, and played with the baby. So for the first 4 weeks of life, a fever is an admission to the hospital. We'll get blood cultures, we'll get urine cultures, and we'll do what's called a spinal tap, which is putting a needle into their back to get some spinal fluid, and we'll check all 3 of those to make sure there's no infection. Usually 2 days, the cultures are negative, the baby gets to go home again. But I just want to warn you that that is something we take very seriously. If you want to get a room full of pediatricians to move in a hurry, you tell them that, you've got a 3-week-old baby with a fever of 101. If your baby looks more orange or yellow when you get them home, we should probably know about that too. If they're not waking to feed, like I said, you need to wake them every 2 or 3 hours and feed them. Now, the day you get home, when all the grandparents are there and all the cousins are there and everybody's passing the baby around and everybody's really enjoying this and finally they all leave, your baby may sleep through one of their feedings. You may go to wake them up and they're just not interested because they're tired. They're just as wore out as you guys are. But if it gets to be a second or a third feed and they're not waking up, that's a way that they tell us that they're sick, because babies after 4 or 5 hours are going to want to eat and they're going to be hungry. So if you can't wake them up and you can't get them to latch on or you can't get them to take a bottle, we need to know about that. And the other thing we need to know about is a bulging soft spot. Babies all have a soft spot on the top of their head, and if that's a bump and it's bulging, we need to know about that right away. The scariest one I think I've ever had was a 3-month-old where mom said, well, he's kind of fussy. Anything else going on? Yeah, he's got a bump on the top of his head. It was like, you need to go to the emergency room. I'll meet you there. Because, and this baby wound up having meningitis and was really sick for a while, but fortunately is doing fine. But those are the concerns we need to know about. Hopefully most of your pediatricians will go over those with you before you get discharged. But if you take anything home tonight, cut that part out and put it on your refrigerator, because those are the things we need to know about. The way that babies communicate is they cry. One of the most beautiful, touching memories I had as growing up, and it stayed with me until my 3rd year of med school when I took pediatric rotation, was when my brother was born. I'm 7 years older than my brother, and he came home in December. It was his room. There was a nice soft light on. It was just a beautiful Sunday evening when he got home, and I got to go in and meet him for the first time, and he was laying in his crib, and he looked at me and he smiled. And my parents made a really big deal about that was the first time he had ever smiled, and he smiled at his big brother, and wasn't that really touching? And I carried that memory with me until my 3rd year of medical school when I found out it was probably gas. Because babies can't see and socially smile till they're about a month or so of age. So the only way they communicate to you is they cry. And those of you that have had children before will know that you will learn the different cries. I'm hungry, I'm scared, I'm cold, I'm just angry at the world. You'll learn those different cries. The causes of babies crying and being fussy, and I've got them listed there. There's quite a few of them. And part of your job as a parent is to try and figure out what exactly is causing your baby to cry. And I also listed there 5 ways to try to make them be quiet. Swaddle them. Remember, they've come from the womb, and the last month or so, it's a pretty tight environment in there. So that's what they're used to. Oftentimes, just swaddling a baby really tightly will help them calm down. I don't know if any of you are OB or labor and delivery nurses, but you guys really rock when it comes to swaddling babies. I still, after all these years, have not been able to get a baby swaddled as well as those nurses can. But And for guys out there, especially if you're baseball fans, you can probably Google it. I haven't tried to do it, but back in the 60s, there was a baseball player who came up with a dad's guide to raising a baby, and he talks about how to swaddle a baby using the baseball diamond. You start with second base, you fold it down to the pitcher's mound, you put the baby right there, and then you fold first base over and tuck it under, and then you take the home plate up to shortstop, and then you flip third base over and tuck it under. And it actually works pretty well. So if you're a baseball fan, that's a way you can swaddle your baby. Try placing them on their side, shushing them, and that refers to any type of sound. There was actually an obstetrician who had some of his women patients allow him to put microphones up into the uterus. And he recorded sound levels of 75 to 90 decibels. It's really noisy in there. And what's the first thing we do when a baby's born? Shh, don't wake the baby. Well, they're like, what the heck's going on? I've just come from this loud environment, and I'm going to make some noise because that's what I'm used to. And for those of you that have dealt with colic, what's one of the best ways to help a baby quiet down? Run the dryer, run the vacuum cleaner, have a radio going at a fairly loud level. That sound is what they're used to, and that helps quiet them down. Swinging your baby, just rocking them back and forth, or allowing them to suck on something. If they've just eaten and you don't think they're hungry, a pacifier is certainly appropriate to use to help them quiet down. There's a few things here we'll go over quickly and have some time for questions. You may hear something thrown around called MSPI. This is milk soy protein intolerance. Babies can't tolerate the protein in milk or soy. It looks like an allergy, but it's actually not. And the way to treat that is usually, unfortunately, if your baby has, there's a diet that moms can go on. It's an MSPI diet, and we all have information about that. It's a pretty rigorous diet. So the other thing you can do is use hypoallergenic formulas where the proteins have been broken down into smaller pieces. The good news is most babies grow out of this by about a year. Something else that will make babies fussy is reflux. Reflux is the lower esophageal sphincter, which is the muscle between the esophagus and the stomach, is not fully developed. The job of that muscle in us is to be closed. And when we swallow, there's a message that goes down and says, open up, there's food coming. The food goes in and it closes again. In babies, they don't get that message to close again. And so that sphincter will stay open for variable periods of time. Babies will spit up, babies will burp. It's only a problem if the baby's irritable, losing weight, or if you see blood when they spit up. There are a lot of babies that spit up that we call happy spitters. They're fat and they're happy and they spit up and then they smile when they do. It's kind of like, look what I did. And they're gaining weight fine. And we usually don't bother to do anything with that. But if we do need treatment, we usually use some sort of anti-reflux medication. And again, the good news is this gets better within 6 to 12 months. Colic, it's not actually Greek for why won't this baby stop crying, but it should be because they just cry and cry and cry. Colic usually starts about 3 to 5 in the afternoon, lasts for about 3 to 5 hours, and is usually better by 3 to 5 months of age. Usually doesn't start till 3 to 5 weeks of age. And the best theory we have is that it is some sort of developmental issue. A lot of parents will say, well, it seems like there's something wrong with their tummy. You know, there's all kinds of things available out there. There's colic drops, there's gripe water, there's, all these theories about what to do. Again, it's kind of an individual thing, what you find works for your baby. And then I threw in some other things that babies do to drive their parents crazy. They sneeze and they hiccup, and that's completely normal. That is their nervous system developing, specifically their diaphragm. The diaphragm is one of the few muscles in the body that is double innervated, meaning that the autonomic and the regular nervous system control it. If you go out and you start running, your diaphragm will work faster, and there's nothing you can do about that. But you can also stand here and start breathing faster. So because your diaphragm has that double nervous system, it takes longer to develop and mature, and that's why babies sneeze and hiccup. It's part of the developmental process. Their tear ducts are a lot smaller. They will get mattery eyes. As long as the white part of the eye is not red or bloodshot looking, we're not worried about it. Just wiping it, using warm compresses, and eventually that tear duct will get bigger as the baby does. Babies will grow their fingernails. Babies do not know that this is their hand and that those are their fingernails, and they will grab themselves and they will cut themselves and they will do all these fun things, and you're worried about what to do. And the best thing that I recommend is just get a nail file, because unless both of you want to spend an hour trying to trim your baby's nails with a clipper, a nail file is a lot easier because they will pull, they will move, and invariably you'll cut their finger, which doesn't hurt them, but makes you feel horrible. And they do cry for a while. So it's a lot easier just to file their nails for the first few months of life. They will look at you cross-eyed, and that's completely normal because a newborn's vision is about 20/400. And anything outside of about 12 inches they won't really focus on it. And they will look at you cross-eyed till they're about 4 or 5 months of age. So that's normal. Don't worry about that. They'll get white stuff in their mouth. If it scrapes off with your fingernail or with a popsicle stick, it's probably just formula or milk. If it doesn't scrape off, it's probably thrush, and we need to know about that. Thrush is a yeast infection, which babies are very prone to. And the other thing that babies do is they breathe funny. They'll breathe real rapidly for 10 or 15 seconds and then hold their breath. They don't really hold their breath, they just stop breathing. And not stop breathing like, oh my goodness, we have to call 911. But again, that's part of their diaphragm developing. And they like to do that just because it drives their parents crazy. Went over here just a few rashes that you may see with babies. Baby acne is precisely what it says. It's acne in babies. The hormone that triggers the baby to be delivered is estrogen. So when you are ready to deliver, you will get a huge dose of estrogen. That crosses the placenta, and then of course we tie the cord and cut it. Well, all this estrogen is now trapped in the baby, and the baby doesn't know what to do with it, so the baby tries to go through puberty, which is what happens. They get acne. In boys and girls, you will see possibly breast bud development, and in girls, you'll see kind of a whitish vaginal discharge. As the baby metabolizes that estrogen, all of those will go away. And this is a non-scarring acne, and it's not going to be a problem, and you don't have to put them on Clearasil or anything. They'll get better by themselves. Seborrhea is a big fancy word for cradle cap. It's kind of those scaly, yellowish, greasy scales that they'll get, especially on their scalp and on their face. Milia is the little white dots that they get all over the place, and diaper rash obviously is a rash in their diaper area. Very common in babies. Poop tends to be the major problem because most babies' poop is acidic and is more likely to cause the diaper rash. I touched real briefly on SIDS because it's in the back of every parent's mind. The thing that is most helpful with that is the Back to Sleep campaign, which is exactly what it says. The baby sleeps in a crib on a harder mattress on their back with no stuff, meaning stuffed animals, pillows, any of those things in the crib, in comfortable clothing. And it's really important to make sure that nobody smokes around the baby. And that means also, my favorite comment of that is there's always a person who smokes outside. And one of the pulmonologists told me that that's equivalent to saying I only pee in the shallow end of the pool. It doesn't really matter. The smoke is going to be on your clothing, in your hair, and so forth. So if you do smoke, it might not be a bad idea to have just something that you can put on, go outside and smoke, and then take it off and come in, because you will cut down on the smoke exposure for your baby. Some final thoughts. Again, your baby hasn't read the book, so everything we've said tonight is going to be new to your baby. Take time for yourself and for your partner. That's very important. If you have other siblings, don't neglect them. And 18 months to 3 years of age is an important, crucial role. I always laugh at the fact because the parents talk about how when the brother or sisters come up to meet the baby, they're really excited and they do great in the hospital because in the mind of an 18-month to a 3-year-old, seeing a baby in the hospital is equivalent to going to the zoo. You go to the hospital because that's where babies are. You see the baby, and then mom and dad come home. They're not expecting this baby to come home. And so when you do come home with the baby, especially with that age group, it's kind of a shock. You may see regression in the 18-month to 3-year-old because logically their mindset is the baby cries, the baby wears a diaper, the baby drinks from a bottle. If I do all those things, mom and dad will send the baby back and we'll be fine. So you'll notice all of a sudden the 2-year-old who has been off the bottle for a year now wants a bottle. The 3-year-old who's been potty trained for a year now starts having accidents and says they need to wear a pull-up or they need to wear a diaper. And you start seeing a lot more temper tantrums and meltdowns because obviously the baby cries, well, then I'm going to cry. So those are completely normal reactions. Just kind of work through it. A very important thing is to spend time with your other children, one-on-one time with them. And that may be just one parent, but it might be something, and you got to do that every day so that that child still feels comfortable and assured. And after a couple weeks, they'll kind of get the idea, okay, the baby's here to stay. Everything's cool. Mom and dad still love me. I'm going back to just being my normal self, and I'll pee in the toilet and I won't drink from a bottle and I'll be fine. Again, never, never, never shake a baby. That's very important. You'll hear that in the hospital all the time. They'll probably make you watch a video that says that. If you're overwhelmed, find somebody to help you. I mean, even if it's calling your pediatrician's office or your OB's office, just to talk to somebody. Because there will be times when you will be tired and the baby will be screaming and you're kind of at your wit's end. And we're here to help you through those times. And most importantly, and if you ever have the opportunity to take an embryology course or to take some sort of a human growth and development course and you want to be just wowed, I would encourage you to do that when you realize that from a sperm and an egg that are microscopic, you have this 8-pound, 5-ounce being who grows up over the years to become, a toddler and a kindergartner and a teenager and an adult. It's pretty amazing. And so most importantly, take time to really enjoy your new arrival, this new person who's coming into your life, because it's pretty overwhelming and it's pretty awe-inspiring. So with that, it says that we're supposed to go till 7 and we have 2 minutes left, but I would be more than happy if anybody needs to leave or wants to leave, that's fine, but I'd be happy to entertain questions or comments and certainly I'll be around for a little bit afterwards if you want to come up and talk. So. And if nobody has any questions, I learned a long time in seminary that when I gave a sermon, nobody ever got mad at you if you let anybody out early. So we'll go ahead and let you guys leave. Thank you very much for your attention and good luck to all of you. And I'm supposed to tell you there's goodie bags that